If you're over 60, listen carefully. There's one routine medical test, something millions of seniors agree to every year, that could quietly raise your stroke risk. Not next month, not next year, but within the next 24 hours, while you're asleep. And it's not as rare as you think. In my 2 decades as a brain doctor, I've seen this happen to too many older adults who believed they were protecting their health. They were looking out for their heart health as seniors, yet this one harmless test pushed them closer to danger. That's why today, we're pulling back the curtain. I'll reveal the 3 most common medical tests that can quietly trigger this risk, explain what can cause a heart attack or stroke after these procedures, and show you how to spot the early warning signs of a heart attack or stroke before it's too late. Most importantly, by the end of this video, you'll know the 3 questions every senior must ask their doctor before saying yes to any scan or procedure. And make sure you stay with me, because test number 3 is the most overlooked and potentially the most dangerous. Let me tell you about Walter. Walter is 74 years old, a retired Navy veteran who still mows his own lawn, plays cards with friends twice a week, and never skips his annual checkups. By all accounts, he's the picture of health for his age. He follows every recommendation his doctors give, keeps his blood pressure under control, watches his salt intake, and even takes a daily walk for his heart health as a senior. Last spring, Walter's doctor ordered a routine abdominal CT scan with contrast dye. Nothing alarming, just a precaution to rule out digestive issues. Walter didn't question it. Why would he? His doctor said it was routine, and Walter had done everything right. The scan took less than an hour. Walter felt fine afterward. He drove himself home, made dinner with his wife, and went to bed thinking nothing of it. But 48 hours later, everything changed. Walter woke up feeling strange. When he tried to tell his wife, his words came out slurred. The right side of his face felt heavy. She called 911 immediately. At the hospital, Walter was diagnosed with a minor ischemic stroke, the kind that sneaks up silently, without pain, and can rob a healthy senior of independence overnight. The doctors traced it back to the contrast dye used in the scan. Walter's kidneys, though not failing, were already weakened with stage 2 chronic kidney disease, something he wasn't even aware of. The dye put extra stress on his blood vessels, triggering vascular spasms and microclots that traveled to his brain. Walter's story hits hard because he didn't do anything wrong. He ate well, stayed active, took his medications, and trusted his doctors. But he didn't know the symptoms of a silent heart attack. He didn't know the right questions to ask about these tests, and he didn't realize that even a healthy-looking senior can be one procedure away from serious risk. And Walter isn't alone. Every week I meet patients like him, people who had no chest pain, no obvious heart attack warning signs, and no idea of what the symptoms of a heart attack might look like in seniors. Yet a single routine test pushed their bodies past the tipping point. Walter survived, but his story is a wake-up call. Recognizing silent heart attack symptoms and hidden stroke risks is just as important as treating illness itself. So, why did Walter, and so many seniors like him, end up in a hospital bed after a routine test? The truth is, our bodies change dramatically after 60. Even if you feel strong, the way your heart, blood vessels, and metabolism respond to stress isn't the same as it was at 40 or even 50. And understanding those changes is the first step in learning how to prevent heart disease and reduce your stroke risk. 1. Blood vessels. Stiffer, more fragile. With age, arteries naturally lose their flexibility. The smooth inner lining, called the endothelium, becomes less elastic, often due to years of cholesterol buildup, mild inflammation, and oxidative stress. This makes every spike in blood pressure far more dangerous. What your body shrugged off easily at 45 could now cause a tiny rupture or trigger a clot at 65. A simple stressor, like the contrast dye from a CT scan, or a sudden drop in blood pressure during sedation, can cause your vessels to spasm. These spasms, while invisible to you, can trap platelets and form microclots that travel to the brain or heart. 2. Kidneys and liver. Slower to clear toxins. Even if your doctor hasn't told you, kidney and liver function typically decline quietly after 60. According to the CDC, nearly 40% of Americans over 65 have some degree of reduced kidney filtration. often undiagnosed. Why does that matter? Because many diagnostic tests, like CT scans or MRIs, use contrast agents, and procedures like colonoscopies rely on sedatives. When your kidneys can't filter those chemicals efficiently, they linger in your blood longer, stressing your vascular system, altering blood pressure, and even thickening your blood. It's a hidden chain reaction that can set the stage for a stroke within hours or days. 3. Cholesterol, insulin, and blood clots. Aging also brings metabolic shifts. Even with a healthy lifestyle, your cells often become more resistant to insulin, leading to higher circulating sugar and triglycerides. Combine that with LDL cholesterol creeping up, and your blood can become stickier, more prone to clot. This is one reason so many seniors experience a first stroke or heart event, even when their numbers aren't that bad. It's not just the numbers, it's how those numbers interact with stress from medical procedures. Number 4. The silent warnings. The good news? Your body often whispers warnings weeks before a crisis. Research published by the American Heart Association shows that many older adults report subtle, overlooked symptoms, what I call the 7 symptoms of heart attack, 1 month before. Unusual fatigue, even with light activity, shortness of breath at rest, mild chest tightness that comes and goes, dizziness or lightheadedness, swelling in the ankles or feet, sleep disturbances, waking up gasping, sudden anxiety or sense of impending doom. Most people brush these off as just aging or stress, but they can be critical red flags. Recognizing them and acting early is one of the most powerful ways to prevent heart disease and avoid a life-altering event. 5. What can you do now? Before we dive into the 3 most common medical tests that can trigger these issues, remember this: your age isn't the problem. Lack of awareness is. By knowing how your body changes, supporting your heart and vessels with vitamins for heart health, omega-3s, and anti-inflammatory foods, and asking the right questions, you can stay one step ahead. But here's the real question. Have you ever felt unusually dizzy, foggy, or fatigued after a scan or procedure? Comment yes or no below, because your body may have been signaling something serious, and sharing your experience could help another senior avoid the same fate. Now, let's talk about the 3 routine medical tests that are most likely to trigger this risk, and how you can protect yourself every time your doctor orders one. CT scan with contrast dye. For many seniors, a CT scan sounds harmless, a quick test to help the doctor see more clearly. But when contrast dye is injected, the story changes, especially after 60. These contrast agents, often iodine-based, are designed to highlight organs and blood vessels. What most patients aren't told is that these same agents can stress your cardiovascular and kidney systems. If your kidneys are even slightly compromised, something nearly 40% of seniors have without realizing it, the dye lingers longer than it should. As it circulates, it can trigger vascular spasms, raise blood pressure, and encourage microclot formation. These clots don't have to be big. Even a tiny one traveling to the brain can block blood flow to a small artery, leading to a silent or overt stroke, often within 24 to 48 hours. This is why heart health for seniors isn't just about cholesterol or blood pressure numbers. It's also about understanding what can cause a heart attack or stroke beyond the obvious risk factors. How to protect yourself? Ask your doctor, can this scan be done without contrast? Request a kidney function test before the procedure. Hydrate well before and after, unless your doctor says otherwise. The good news? Most of these risks are avoidable if you ask the right questions and know your baseline health. But what about a test that doesn't involve chemicals at all, just walking on a treadmill, and can still send a healthy senior straight to the ER? That's next. Exercise stress test. If you've ever heard, let's schedule a stress test just to check your heart, it might sound like good preventive care. After all, walking on a treadmill for a few minutes feels harmless. But for older adults, especially those over 65, a treadmill stress test can be more than just a workout. It can be the spark that lights a fire. During this test, your heart is intentionally pushed to its limit. Your pulse rises, blood pressure surges. Arteries, which may already be stiff or narrowed, constrict even tighter. If you have undiagnosed narrowing or a small pre-existing clot, the strain can dislodge that clot or rupture a fragile vessel. Consider Margaret, age 72. She had no chest pain, no dizziness, just mild fatigue. Her doctor ordered a treadmill stress test to be safe. She felt fine afterward, just a bit tired. But by morning, she couldn't lift her coffee cup, her right hand wouldn't obey. A quick response got her to the ER in time, and she fully recovered. But her stroke was likely triggered by the sudden strain on her cardiovascular system. Have you ever felt lightheaded, unusually weak, or off after a medical test? Comment yes or no below. Your experience can help other seniors recognize what's normal and what's not. How to protect yourself. If you have no chest pain or major symptoms, ask, do I really need this treadmill test? Ask about pharmacologic stress tests, medication-based, or a resting echocardiogram as safer alternatives. Support your arteries with the best diet for heart disease: leafy greens, omega-3 rich fish, and minimal sugars. And now the most deceptive one of all. No running, no chemicals, just a routine scope most seniors get, and yet it can quietly set off a chain reaction overnight. Endoscopy or colonoscopy with sedation. For most people, procedures like endoscopies and colonoscopies feel routine. You get sedated, the doctor checks your digestive tract, and you wake up groggy, ready to head home. But for seniors, the sedation itself can be a silent risk. Sedatives intentionally lower your blood pressure and slow circulation so you can relax and remain still. That sounds harmless, but if you're over 60, especially if you take blood thinners like warfarin or aspirin, this slowdown can create a perfect storm. When blood moves too slowly, it's more likely to form clots or allow existing ones to migrate. If one travels to your brain, you may not notice until the next morning, when you wake with dizziness, imbalance, or slurred speech. All signs of heart attack or stroke that are often brushed off as normal recovery. How to protect yourself? Ask, can this be done with minimal sedation or none at all? Ensure your doctor reviews your blood pressure and medication list beforehand. Support recovery with a diet for congestive heart failure principles: light, low-sodium meals, hydration, and gentle movement. The hopeful truth? These risks don't mean you must avoid care. Most complications can be prevented with simple questions and post-procedure awareness. Knowledge and early action are your best allies. So, with all these risks hiding in tests we trust, how can you stay safe, reduce your stroke risk, and protect both your brain and your heart? The good news is, there are 3 simple steps you can start today. Now that we've uncovered the hidden risks in these common medical tests, let's talk about how you can take control, starting today. The goal isn't to fear every appointment. It's to be informed, to protect yourself, and to keep your heart and brain as strong as possible. Here are 3 simple steps you can use right now. 1. Ask the right questions at every appointment. Before saying yes to a CT scan, treadmill test, or any sedated procedure, ask your doctor, is this test essential for me right now? Can we do it without contrast or deep sedation? Have you reviewed my kidney function, blood pressure, and medications? Doctors respect patients who ask questions. It shows you're engaged and it helps them tailor safer care. Number 2, support your cardiovascular system every day. A healthy daily routine can make a huge difference. Start with an anti-inflammatory diet for congestive heart failure prevention and overall vascular health. Leafy greens, omega-3 rich fish, and unprocessed sea salt instead of regular salt. Limit processed sugars and refined carbs to reduce inflammation. Practice deep breathing and light walking every day to improve circulation. Adding the best supplements for heart health, such as CoQ10, magnesium, and high-quality omega-3s, can further support energy and vessel flexibility. Always confirm with your doctor first, especially if you're on medication. 3. Monitor your body after any procedure. Even a minor test can temporarily stress your system. If you notice dizziness, fatigue, confusion, or anything that feels off, don't brush it off. These could be early warnings. Seek help immediately. Protecting your health after 60 isn't about avoiding care. It's about being proactive, informed, and supported with the right habits and the right vitamins for heart health. Before we wrap up, I want to hear from you. Comment safe below if you're committed to asking those 3 critical questions at your next doctor's visit. And if you or a loved one has ever experienced unexpected dizziness, confusion, or weakness after a routine test, please share your story. Your experience could help another senior avoid a stroke and remind us all why staying informed matters. In our next video, we'll explore 3 powerful foods that naturally help clear your arteries and strengthen your circulation, a vital part of effective diets for heart health and supporting your body with the best vitamins and supplements for heart health. Remember, staying safe after 60 isn't about fear. It's about knowledge, small, smart choices, and protecting the only brain and heart you'll ever have. Stay aware, stay proactive, and take control of your health journey.